I'm Jake Levy. I'm the Chief Revenue Officer with Claris Healthcare. I came all the way from Sandy Springs, Georgia to be here. So thank you very much. I'm guessing that there's a person on my panel that's going to win the award for the longest distance travel to be here. I'll keep you in suspense for just a few minutes on that. So the title of this session is a look at technology-enabled care. We're really going to drill into some specific populations that coincide with a couple of the panelists that are here. But I do have a question in the audience. Who here is part of a care provider? Raise your hand if you're part of a care provider. Outstanding. And everybody else are on the AgeTech side. Are there any other categories represented here? Do we have anyone from the investment community that's here as well? Excellent. Great. I'm going to have a few more opening remarks, but what I'd like to do is let my superstar panel introduce themselves. I've asked them to take 2 minutes to tell you who they are. And I think for context, it would be good for y'all to just describe your organization for just a moment as well. So thank you. Karla?
Thank you, Jake. Good afternoon, everyone. My name is Karla Radka, and I am the President and CEO for Senior Resource Alliance. We are the area agency on aging in Metro Orlando, which is the central part of Florida. I am very glad to be here today to share some best practices and how we have leveraged technology to support seniors in Central Florida. We know that Florida is one of the top destinations in the country for seniors to go, live, and play on their golden years. So the amount of seniors that we have in our area is significant. We serve about 500,000 seniors within a year. Every single year. So it is important to keep this population vibrant, strong. Many of our seniors are not the most vulnerable, but still are the ones who want to volunteer and the ones who want to continue to serve and find purpose in communities. And that is our goal, to keep them healthy and strong and with purpose and aging in place. Thank you.
Thank you, Karla. Geoff?
Geoff Auchinleck. I'm co-founder and CEO of Claris Healthcare, so I'm with Jake. The mission of Claris Healthcare is to address exactly what we heard in the introduction, to take away the unnecessary complexity and difficulty for seniors to use technology. Come on, software guys, we can do better. Stuff should be accessible, obvious, and easy. That's the mission of Claris.
And where are you from, Geoff?
Oh, I'm from Vancouver, Canada, so I've come 2,700 miles. I think I win the prize.
Yeah. Anybody further than Vancouver? You win.
Hi, good afternoon. My name is Nitasha Burney-Fleming. I'm a family physician. I work as the Chief Ambulatory Officer at Grady Health System. I've been there about 2.5 years. So happy to serve in that role. I began my practice of medicine on the south side of town as a solo practitioner. No one does that anymore. My mission led me to Grady because of the healthcare desert that was created on the south side of town. And I wanted to get back to serving that population. About 35% of our patients are seniors, and most of my job is to provide access in vulnerable areas in Fulton and DeKalb County. So since I've been at Grady, we've opened several clinics in vulnerable populations, and we're due to open 2 in DeKalb, where there are very few healthcare providers in that area. And so we depend on technology innovation to reach our patients that have social determinants of health that are unable to get to a physician or an APP. So really proud of the work that we're doing at Grady and proud to be here to share it with you.
Good afternoon. Chris Appleton, I'm the CEO at Art Pharmacy. We're a social prescribing company. I'll talk about what that is in a moment. But before I do, I'm going to ask a question. Raise your hand if you know that your health outcomes are connected to your physical activity level. Silly question in 2025. I'm 43. I don't remember this time, but does anyone in the room remember when we didn't know that our health outcomes were connected to our physical activity level? couple of people raised their hand. So during my lifetime, but before I was doing this work. Well, raise your hand if you know that your health outcomes are connected to your engagement with art, culture, creativity, and community. Imagine in a generation when a room of people like us are sitting together and health plans are paying for memberships to your local museum, community arts center in the same way they're paying for your membership to a gym or a fitness program today. That is the future that we are building. We enable healthcare providers to prescribe participation in non-clinical community-based activities for their patients, to deliver clinical improvements in clinical care and drive down costs for the health system. We do that in 9 states across the country, based here in Atlanta, Georgia.
All right, thank you very much. I'm going to say a couple other comments just for context and give you guys a little bit more background about what my company, Claris Healthcare, does. And I was thinking about the best way to communicate that. And I'm going to do it with a little bit of a brag of one of our audience members. So there's a wonderful daily online magazine called Georgia Trend. And today there was a fantastic article that was published about how ARC, Atlanta Regional Commission, which is the area agency on aging, Becky Kurtz, if you'll just raise your hand there, an amazing collaboration built around technology where ARC collaborated with Claris Healthcare. And in the other room, there's a speaker over there. He's a tall, goofy guy named Eric Levitan with Vivo. Many of you know Eric. And we brought in Atlanta Public Housing. And we put together a program to deliver virtual evidence-based program, to hundreds, if not thousands, of seniors across Metro Atlanta. And one of those programs involved Vivo's online strength training. And it's just amazing to see the kind of outcomes that can happen with the kind of collaboration that we're really all here trying to make happen. And just to give you a visual, what Becky's group did is they put together a program that's designed to run on this very simple senior design tablet. Now, not all seniors require the Claris Companion tablet. Some of them use their own phones. But going back to this idea, sorry, I was told not to hold it at the bottom, and I learned that. Going back to this idea of serving vulnerable populations, that's going to be kind of our next theme that we're going to talk about. That's, I think, the commonality between SRA and Grady Health is they have the privilege of focusing on more vulnerable populations. And so we are thinking about those seniors that are on the other side of the digital divide, that don't have digital literacy, may not have internet access, and oftentimes social isolation is a really challenging issue that both Becky and Karla take on in their social services agencies. Just another statistic, we're going to leave here with all kind of numbers in our head. There's about 16.2 million Americans over the age of 65 that live alone. There was a phenomenal statistic that blew me away that AARP published months ago, that Medicare spends an additional $6.7 billion providing additional services for socially isolated seniors. It's a big problem. So that's, by way of example, that's a good bit of what Claris Healthcare is all about. We also have a healthcare practice on the other side of our business where we help our healthcare provider customers remotely monitor and manage patients with chronic disease. So enough said about that. Put this back. All right. So let's go down with our first topic. The first topic is this theme around the intersection of social care and healthcare. We're seeing a lot of overlap in that Venn diagram, how healthcare providers are very much concerned about social determinants of health, which I don't know if you know this, under the new administration has been rebranded as upstream drivers. So CMS has removed the term social determinants of health, and it's now called upstream drivers. But healthcare providers have been concerned about that for some time. It's just not easy for Grady to operate outside the 4 walls of their facility. And I think that's where organizations like SRA, Senior Resource Alliance, can really make a difference. So for topic number 1, predominantly targeted for our care providers. Can you talk about ways that your organizations are collaborating in your communities and how technology is playing a role in that? And I'll be specific, how age technology is playing a role in that. And I'll turn it over to Karla first, direct that question.
Yeah, thank you. I think it's so important to address the issue of social isolation with the elderly. It is the equivalent of smoking 15 cigarettes a day. It is expensive, not only financially, but in terms of healthcare and mental health. So leveraging technology and to be able to have Claris tablets to seniors, especially the ones that are living alone, and to create those networks that maintain that connectivity and that ecosystem among other seniors in a controlled environment where there is no risk of them being victims of fraud or anything that it can be detrimental for them is important. And one of the takeaways of utilizing technology, and specific the Claris tablet for seniors, is that it's available in so many languages. So being in a community like Central Florida, where it's so diverse, it is important to have that ability to have services and technology that is multilingual and is very diverse, not only in terms of the language, but also with the services that are available through the tablets. Yeah, reminders to take medications, access to recipes for healthy eating, reminders for exercises, and routine for exercises. So that technology distributed in the community in a way that is intentional among seniors that are isolated, so they can build their own network, so they can remain connected, and leveraging that technology so they can be healthier, stronger, and using mobility, that to as a part of their daily routine is very important, and something that it has proven great success, especially when we started implementing some of these technologies coming out of the pandemic.
Thank you, Karla. Nitasha, can you add anything in terms of how Grady Health is looking at technology or how it might be leveraging technology for older adults?
We found that with this new administration, with telehealth being maybe a concern now, a lot of our seniors actually log in, and that is the only way they can get care. So we depend on technology for our video on demand team to be able to reach our patients. And then we also rely on remote monitoring as well for our patients that are vulnerable, to cut down on readmissions for our most vulnerable patients with congestive heart failure, COPD. Those conditions are what takes patients back to the hospital. So our goal is to keep patients at home, keep people well at home, and to maintain their health through our video visits. And so that is how most of our patients that live remotely are unable to reach facilities, even though we're all over the city, that they are able to use technology in that way.
Thank you, Nitasha. Chris, any examples that come to mind in terms of how technology is being leveraged in the area that you specialize in?
A couple come to mind. So, we all as healthcare consumers are increasingly asking for, even demanding, not just personalized, but precision medicine for our physical health, as we ought to be. But for social care, for our social health, and for our mental health. And when I say our social health, I really mean our relational health, less so the social drivers of health, traditional social drivers of health, food, housing, transportation, very, very important work, but not our lane. The social health space, you get discharged from the hospital, it's like, here's an 8.5 by 11 piece of paper, good luck. And we ought to be demanding the same level of personalization for our mental health and for our social health as we are for our physical health. And what that requires is a lot of supply for the types of social, non-clinical, community-based activities, those social activities. So we have a national network of community partners, a couple thousand partners across the country that are your local museums and dance studios and community arts centers and libraries and senior centers that are already providing community-based activities. The supply is already there. We don't need to go make new inventory as a field. What we need to do is get people connected to the right supply, the right activity, right place, right time, and have it be personalized. I can share actually a Grady specific example. We work with the palliative care and the cancer center at Grady, and we actually just finished up a 12-month study, chart review study for patients in the cancer center. A 77% fewer avoidable ED visits, 71% fewer hospitalizations, and 23% fewer missed appointments compared to the control group. And I think that, Art Pharmacy and our platform is great and all that sort of stuff. I don't think those numbers, that impact, are about Art Pharmacy. We are connecting people to life-affirming, life-enriching, in-person care, right? Part of the reason, this isn't the case for everyone, but part of the driver of the social isolation and loneliness challenge, the chronic loneliness that was referenced in, the 15 cigarettes a day, has to do with the social disconnection as a result of technology. And so technology plays a very, very important role in enabling us to connect with individuals in person, but we cannot leave the humanity out of it.
Thank you, Chris. I want to stay on this theme of the intersection of social care and healthcare. Karla, I know you've done some work in your community with some of the healthcare providers. Can you just take a minute and talk a little bit about the work that you've done and some of the outcomes that you've seen?
I think that you're referring to the hospital readmission prevention program that we have put in place in Central Florida in partnership with a major hospital, Advent Health. And we have some other hospitals and healthcare plans that are following out of the success that we have with this program. The whole purpose of designing this hospital readmission program, it was just to treat our seniors the way that we want to be treated, and that we will treat our parents and grandparents when they have to leave the hospital. And that is ensuring that all their appointments are scheduled and met, that there are no barriers that we cannot overcome, including our community healthcare workers opening the refrigerator, and if there is a delicious chocolate cake in there, just to throw it out and fill it with good, nutritious meals. The leverage of technology is so important, because if ahead of that discharge, everything is uploaded on technology and is going to serve as reminders for medications, for appointments, that is very important. The success rate that we have right now with 6 hospitals in our community for patients not to return to the hospital in 30 days is 94%. We're still surprised out of our success, but we never take it for granted either. And I think that we need to remain humble and listening to our patients and continue to do the work with all of our incredible partners, especially the community healthcare workers. But they are the ones who actually have demand, to a degree, a level of technology. Like, they want to have a hotline that if there is a patient that is isolated, sad or anxious on the weekend, that they can call, so they can be responsive to the needs of those patients. So technology has been super important for that.
Thank you very much for that, Karla. Geoff, I know that Claris is seeing a big trend towards social care and healthcare organizations collaborating. I thought I would give you the opportunity if there's anything that you wanted to highlight that you're seeing.
Oh, yeah. I'm old enough that I can tell stories. And 13 years ago, when we founded Claris Healthcare, notice the healthcare part. Our assumption was that in order to deliver healthcare into the homes of seniors, you needed some kind of an easy-to-use internet connection. So we designed a thing we called the ADA Health Hub. And we showed it to a whole lot of seniors. That talk earlier this morning about involve the seniors in the design. 100% of them said, "This is fabulous. I know a lot of people who really need this, but I don't. I'm perfectly fine. Thank you." Which was my first lesson in the mental age being somewhat different than the physical age. I'm still 30. Remember that. Okay, so we redeployed exactly the same software and said, no, actually, this is a family communications hub to connect you with family and friends and get involved in the community and go and attend programs at your local senior center, which may occasionally interrupt you and ask you to take your blood pressure, but it's not a healthcare device. And all of a sudden it was acceptable. So the underlying thing here that I'm trying to get at here is that that bridge between social care and connectivity and connectedness to family and caregiver and social resources and healthcare is critical to the success. And over the last 13 years, I've seen those two merge. And now we're starting to see this become the core.
Thank you for that, Geoff. Next topic I want to move on to is market challenges. So obviously, there's a lot of change that's taking place in healthcare. We heard that from the doctor from CDC. Horry, Dr. Horry. Thank you. And there's many examples that we can talk about, things that we may not have anticipated. So with the changes in healthcare over the past several months, especially in social care programs, and looking ahead to further changes in Medicaid reform, how is your organization using or planning to use technology to address these challenges? And I'll come back to you, Karla.
I think that with the increase in need, like in the state of Florida, 1,000 new people move to the state of Florida every single day. We get to call them neighbors. Out of that, 20% are over the age of 60. So with increased demand, then it comes the need to be able to leverage technology for efficiency and to be able to manage processes, to be able to serve and meet guidelines and meet deadlines that we have, especially when it comes to programs that are state and federally funded and with deadlines and goals. I think it's very important to be able to just leverage technology to a degree that it can continue to help us to support communities.
And Nitasha, in terms of the changes that have happened in healthcare, I'm sure Grady has a lot to say here.
I think out of all the health systems, Grady's going to be most affected. With the closure of WellStar, we did receive federal and local funding for our Georgia A clinics, which has allowed me to have my job and open up all these clinics to serve our patients in Fulton and DeKalb counties. There are some changes that we're anticipating and we're bracing ourselves for. And with the decrease in funding, then those patients have to go somewhere, right? And so we are preparing for that. We're budgeting accordingly. And we are leveraging technology so that our physicians can see more patients. So we rolled out a bridge, which is our AI technology that allows us to be able to put the device down in the room, it's usually your phone, and record the visit. And so that cuts down on the pajama time with our clinicians working at night to be able to chart and do all the things that we have to do outside of the visit with our patients. And so we're bracing ourselves for the increase in visits, and we're ready for it because that's what we do. We're here to serve.
Thank you for that. Chris, is there anything about the changes in the healthcare market or social programs that has been relevant for Art Pharmacy?
What we're seeing is that enterprise opportunities are more challenging, but local and regional opportunities are increasing. I think local communities are trying to figure out how to respond to the federal environment and to the national landscape, which, that in and of itself, creates some growth challenges for, early stage companies, but do see a lot of opportunity with local partners.
I'm going to stay with this theme here, Geoff, and cue you up for something a little bit more specific. If you can take a moment and talk about the reform that we saw at the beginning of this year around digital equity and how that's impacted our customers on the social care side, and then maybe close that remark out with what may be a ray of sunshine in the new 2026 physician fee schedule.
Yes. So, hello. Oh, there we are. I'm back on. As you all know, the Digital Equity Program was canceled by the new administration. There was a lot of funding that was targeted at our customers in the social care space, which got vaporized. And that has caused massive problems for social care agencies across the United States. In terms of a bright light, however, perhaps coming out of Surgeon General Murthy's report 2 years ago, about your comment about 15 cigarettes a day and how loneliness and isolation is now a health epidemic. CMS is now talking about bringing in new reimbursement codes specifically for addressing loneliness and isolation as a healthcare problem. This would be revolutionary for social care agencies, AAAs and Meals on Wheels and organizations like this that provide these services and have had to depend on annual grants. Now, if they could bill on a monthly basis to CMS, this would be just a revolutionary change. So please, everyone here, do whatever you can to encourage that.
And I'll add one more particular point of light, I think, is that starting on January 1st, there are additional remote patient monitoring codes that are available for health systems like Grady, where physicians can actually bill for services outside of the hospital, outside of their clinic. So, it's nice to see the administration really leaning into the prevention and management of chronic disease. I have to give them credit for that. Okay, let's move on. Topic number 3 is really around clinical value and ROI, which we've touched on that a little bit, but we'll say, we'll start with our AgeTech panelists, and that is, how are you, Geoff and Chris, how are you guys currently measuring and demonstrating a clear ROI or measurable health values for your partners? Chris, you want to take that first?
Sure. When we started 3 years ago, we knew that no health plan executive woke up that morning, and this is still true today, thinking that they needed to buy ART prescriptions. So despite our sort of product and positioning being unusual and different, this idea of an ART pharmacy, we knew in every other way we need to look sort of down the middle of the lane like other healthcare technology products. And so we measured from day one, PHQ, GAD, UCLA3 lowness scores, WHO5 well-being scores at baseline and every single month on our members. So we have 3 years of data on this. And depending a bit on the population, the age, and the chief complaint of the patient, somewhere between a 60 and 75% improvement across those measures. So the clinical impact is pretty clear. For our customers, for our health plan customers, I think sort of reduction in total cost of care and performance measure, sort of bonus opportunities are their drivers. And as I mentioned earlier, avoidable ED visits and reduction in hospital visits is necessary to, impact those numbers for our clients.
Thank you, Chris. Geoff, anything that you can add in terms of what Claris is striving for around ROI, measurable outcomes?
Well, I think Karla Radka here just said the most amazing thing, 95%, help patients don't return to the hospital in the first 30 days. The ROI on that alone just dwarfs everything else. It's huge. Same thing for emergency room visits and that's way beyond anything I could have dreamed of happening. So that's fantastic news on financial ROI. I'm just going to expand on what Chris was saying, though. One of the things that we can do through our platform is actually survey our users with the UCLA Depression Score and various others and basically say, how are you doing? And we have found that it's directly correlated to their engagement with the platform. Their depression goes down, their feelings of loneliness go down in inverse proportion, I should say, not direct. The more involvement they have on the platform, the lower they feel in terms of loneliness and isolation. And that to me is as good an ROI as money, frankly.
Thank you for that. Moving on, topic 4. Where's my host? How am I on time right now? Are we on time here? We're good? Okay, because I want to leave room for questions here. So let's keep cranking here. Accessibility and equity. As AgeTech innovation accelerates, how can we, all of us, collectively ensure that these advancements are accessible, affordable, and equitable for all older adults, regardless of socioeconomic status, digital literacy, or geographical location? Karla, you want to start with that?
I think that technology is so important for everyone, but especially for communities that are isolated, not only in terms of just living alone or not having relatives or friends around to support, but in terms of distance. So for rural communities to be able to have access to technology and remain connected to a hub, to remain connected to a community is very, very important. And how do we ensure that there is equity, that there is access to technology for vulnerable populations? I think it's important for organizations that are on the front lines, and nonprofit organizations are safety nets in communities. And we're there to be able to secure funding, either to philanthropy, to grants, and make these approaches to philanthropies and to grantors about technology, and to really let them see that the old way of granting funds doesn't work. That's an old model when you sometimes need evidence-based, or when you are looking for multiple years of use of something just to continue and to reload grants. I think it's important to educate philanthropists and expose them to the actual needs of, in particular, in my case, of seniors, of caregivers, the need to leverage technology, the need to have access to resources that are proven to be of great use. And to also, in terms of making it easier, one thing that I think is so important, and I want to talk a little bit about this, is a program is called A Perfect Pair. A Perfect Pair is college students that are paired with seniors. College students teach technology to seniors. Seniors talk to college students about life, about the fact that nothing is permanent. Pain is part of life. Anxiety, well, who doesn't have it once in a while? So this Perfect Pair program works very well because it is that perfect combination of educating in technology and then having someone with life experience to be able to decrease those levels of anxiety. In fact, that is evidence-based. When there are elders around, when there are grandparents close to grandchildren, we know that the grandchildren, they have a better balance in life. So just making all those different programs available to be able to create a great tsunami that is all with the whole purpose of creating goodness and leveraging technology.
Thank you, Karla. And Nitasha, I'm sure Grady Health is concerned about accessibility and equity. We can use that word in here.
Yes.
Any thoughts on how we achieve that and make it affordable?
Yeah, health outcomes are tied to equity with technology. One of the things we were talking about in the meeting where I almost didn't make it here in time was how even just not having the correct phone number for our patients is not allowing us to get the remote monitoring to them, to get our home health to them, because honestly, someone could be admitted on a Monday and their phone is cut off due to the fact that they can't pay their phone bill. Then they get another number before they leave. And so we do not have accurate numbers for our patients. It's something that we just take for granted, that I've had the same number for 20 plus years, but our patients don't have phones. So forget the internet. They don't even have the ability to call. And so we depend on philanthropy to have patients even have access to a phone, and then to be able to provide simple internet, because we know that we are not able to reach our patients even to get them to their appointments for the lack of technology. So we depend on our Grady Health Foundation to give those funding to our patients that need it. And we need to do a better job asking the question. I know for when we do ask the social determinants of health, we are not asking enough questions about their ability to access technology. So that is on our strategy plan for 26, is to embed that into the ask when patients are admitted or come to our clinics, so then we can provide that through whatever means we can, to whether it's giving out phones, making sure they have internet access.
Thank you, Nitasha. Okay, last question. So I'm going to ask each of you guys this question. Take 20 seconds to answer this. Chris, I'm going to start with you. Looking 5 years ahead, what's the single most transformative technology or shift in technology policy that you believe will fundamentally change how better care is delivered for older adults?
Wow. I know that you shared that question in advance, and I should have come with a smart answer, but the single most, that's a hard question. I'll say technology that enables people to connect in person with other people.
Love it. I'm going to go to Geoff next.
Well, we heard a talk on AI this morning, and a lot of people put hands up that they're worried about AI. I'm one of those. I think that AI companionship has both benefits and risks. It's good if there's no other choice, but I really want to see AI in the next while turn into a great way of making human-to-human connections and encouraging human-to-human communication.
That resonates. Nitasha, you can think of?
I really like the idea of having patients feel like they can get the connection within their visit at the time. I feel like we're missing that piece, that when they're there, they're not connected. So I believe that if we could have AI technology that is embedded within the practice to connect with social and whatever they may need outside of their visit in that time period would be great. Real-time connectivity.
And Karla, we'll finish with you. 5 years from now, transformative technology or shift in technology policy. What are your thoughts?
I have been thinking a lot about that. And I think that what I would like to see 5 years from now is that technology is solutions-based and it actually answers the questions for seniors and the needs that they have to be able to stay connected and relevant on their community. Either it's related to healthcare, to stay connected with their physicians, if it's for spiritual purposes, to stay connected with a body of faith, or if it's with friends, just to be able to play bingo or any activity that they want to.
Thank you, Karla. Well, that's a wrap up. I'd hope we'd have some time for Q&A. I don't know if we... Okay, any questions or comments for these incredible panelists?
Questions? Did I see a hand? Oh, all right. I'm headed your way.
So thank you for your insights. You mentioned demonstrating reduced readmissions to the hospital, sizable impact on ER boarding as well. You're definitely doing the value. You're demonstrating the value. How are you translating that to the payers to demonstrate what you're doing and for that to then help your overall mission? What are your biggest, obstacles in doing that, and what's your game plan in doing that?
Who are you directing?
You want to take it? So what are we doing with that is translated into funding, into money that it can support other programs. We are actually having a program where we get reimbursed for services that are being rendered to prevent readmissions. The hospitals are extremely thrilled with that because increase their hospital grades, but we're actually repurposing, repackage, re-engineering that initial pilot that we did for hospital readmissions with great success. And as we repackage that, presented to other hospitals to be able to create a source of revenue and a source of income so we can support other programs in the community. So we can support the community with technology that in some cases is still expensive and not financially viable for seniors. So that's what we're doing. It is a social enterprise model. We're social entrepreneurs, and just being able to utilize that model to replicate it and not only just keep it to ourselves, but also share it with the community, share it with the rest of the AAAs, share it with everyone who wants to be able to use this model.
All right. Hi, Amy Schiffman. How are you? AgeTech DC. Woohoo. Sort of a complex question, but for anybody who feels like they want to jump in. So first, a comment. Thank you very much. Number one, digital literacy absolutely is an SDOH. In fact, any age techpreneurs that are out there that want to start, working on that as a for-profit entity, there probably is room to use these new codes, these PIN and CHI codes that you referred to earlier to sort of solve that problem. That seemed like very urgent at one time. I'm not sure if everybody in this room is familiar that on October 1st, the telemed rules rolled backwards. And I was wondering if the doctor could comment on whether or not that actually has affected her ability to get work done, or is the limitation of people's access to telehealth, because they don't have a phone, has it really made an impact at all?
Good questions. So yes, we recognize that the laws have changed, but at Grady, we still see our patients. If that is the only way that you can access care, we are still going to see you no matter what. We just know we're not going to get paid. So that is what we do, and we hope that that won't stay the status quo. And as far as a change for patients, we've noticed that our no-show rates have increased lately because patients aren't able to get to our appointments because they don't have the money to pay for their phone bill. So yes, we are seeing the trickle effects in person and our telehealth visits because they don't have a phone to even let us talk on the phone, forget an internet connection. So unfortunately, we are starting to see it, and this is just the start of it. In November, we anticipate that it's going to get worse.
Well, thank you so much for an incredibly compelling conversation. I'm glad we got to squeeze a few questions in. I'm sorry not to have time for more.